Hey everyone, Healthy Meals to Go, unique opportunity for me as we continue to build and try to help you make healthy choices easy. We have Dr. Elder with the Blair Chiropractic, right? Mm-hmm. And we're talking about chiropractic and health and everything. And
Yes.
Today, you know, as we try to make healthy choices easy and we build on everything, this is part of it is keeping your spine and keeping your full body along with nutrition. So how long have you been in Lubbock, and tell us where you come from and everything. So.
Okay, well, we've been in Lubbock since November of 2017, so it's been a year and a few months. We came to take over the Blair Chiropractic Clinic. Dr. Blair started the clinic in 1949, and I'm the third director. And I'm originally from Southern California, and my wife Ruth is originally from Norway.
Mm-hmm.
Yep.
And so with this, I know, Ruth, you help, you're a nutritional and personal trainer too, right?
Yes.
And
That's my certification.
And so they're combining not only, you know, the spine, but incorporating all that into the practice. But more than that is when I heard you with Dr. Edwards talk, it was about the cervical and doing that manipulation. Mm-hmm. And so explain that because it's just fascinating.
Yes. Well, I find it fascinating. Hopefully I don't bore you all. So the brain controls everything in the body. You could say that the brain is who you are, right? Just keeping metaphysics out of it, just on a physical level. The brain is who you are. It controls every cell in your body. There are nerves going everywhere in your body. Well, the brain sits up in the brain case in the skull. It's pretty well protected. It has to go down through the neck, and it comes down, all the nerves come down through the spine, and then it goes out to the stomach, the lungs, the heart, whatever, and then it comes back, and then goes back up to the brain. Well, the weakest link in that whole chain is the neck, because we've only got 7 bones in the neck, and we've got to be able to move our head around so much that we sacrifice some stability for all that mobility. Well, the problem is, of course, you've got this bowling ball sitting up on top, and if you get into a car accident or have some sort of a trauma where the head jerks, one of those bones in the top of the neck can actually slightly dislocate a little bit. And when it does that, it starts affecting the nerve flow between the brain and the rest of the body. Well, what does the body do? The body's a self-healing mechanism. It doesn't want that. The problem is there are about 10 billion nerves traveling right through between my 2 fingers here. And if there's a problem in that area, the body's going to want to protect it by changing a little bit of your posture, your head. That twist goes all the way down your spine, and that can cause other problems then in the low back and the hips and the knees and the feet, not to mention whatever nerves it's affecting. So it can affect your heart, your lungs, your immune system, your hormones. So there's so many good things in healthcare. The problem is it all relies on your body's ability to react and heal itself. And if that's being compromised up here, then you're not going to you can eat the best food in the world. If you're not absorbing it correctly, if you're not using those nutrients correctly, then because the nerves aren't working quite right, it's just not going to work as well. It'll work, but not as well. So my focus in my practice really is to help people be the best that they can be health-wise by making sure the foundation's there. Now, there's other things they need to do. Right. There's motion, there's hydration, there's peace and all those other things that have to be done, but they're not going to be done as well if the nervous system is compromised, because the nervous system controls all those things.
Right.
And so that's really my focus and my passion.
So if someone is experiencing the chronic pain in their lower back and all that, you found that it could be related to a trauma or something in the past that's never been addressed?
Absolutely.
Yeah.
Yeah. So in our practice, probably, well, I'm not going to say an exact percent, but a large portion of our patients come in for low back pain, and it's a compensation of a problem in the neck.
Okay.
So the original problem happens up here, but then there's a shift that happens all the way down. And by correcting the original cause and going after where's the original problem and fix that, then the body can relax and straighten up and take care of itself. So the brain controls it. So
right.
The beautiful thing about that is you don't have to keep pushing it back in place all the time. So once you take care of, remove the nerve problem, and your brain takes over control, then you own it. The brain can start to heal it and take care of it and heal itself. Really, your brain becomes the doctor that it's designed to be.
And so if someone's having sleep problems or all these things, you found that, what does it look like when an initial consultation and visit when someone comes in, I just don't feel right.
That's really a good question because we don't treat symptoms. People will often ask me, well, can it help this? Can it help that? Well, the answer almost always is invariably, yes, it can, but we don't know until we run some tests. And even then, we don't always know exactly what the pathways are, but if we find that there's a problem in the central nervous system, that can affect your immune system, your hormones, your pain levels. And then you've got all the biomechanic fallout that can cause the low back pain and things. And that doesn't mean that there isn't also a problem wherever the pain is. But that means that if we try to fix just where the pain is, it's not going to heal as well as if we fix the primary problem first. So the initial thing we do is really a screening. Come in, tell me what's going on, let me run a few tests and see if it looks like it's coming from the neck,
right?
Or primarily from the neck.
It's actually really interesting that you threw sleep problems out there, because when I grew up, for the first 20 years of my life, I was incredibly sick and had lots of pain and didn't live a normal life. And part of that is I could never sleep.
Right.
I could never sleep. And after I had my first neck adjustment, the first thing that happened is I slept that night. I think it probably had a good night's sleep for the first time in my life. I was 21 years old, and I'd never really slept through the night until that day. And so that was the first step in my own healing process.
Right. Isn't that awesome?
Yeah.
Yeah. Y'all are making me want to sit up straighter.
I know, I realize that I'm kind of slouched, but
Relaxed, how's that?
what I have found with posture is the important thing is motion. So
Right.
just don't stay in one position too long.
Okay.
That's the best basic rule out there.
So combining, what does a normal treatment schedule look like once you assess, like, okay, I think I can help? Or I
The
found
first
something out of whack.
thing that we do is we take what's called a cone beam CT scan. So CT scans usually are taken laying down. They use a lot of radiation. Well, the dental industry and maxillofacial surgeon industry has developed this machine that really reduces the amount of radiation. It just takes a picture right here, and you're sitting or standing. So we have gravity in place. As soon as you lay down, all your joints change their relationship. So it's hard to tell if something's lined up or not. But when you're sitting or standing, you have gravity in play, and it's just a quick, 30, 40 second.
Oh, wow.
And then you've got this beautiful image on the computer that you can turn upside down, and we can see the actual shape of the joints. Now, this is what Dr. Blair figured out in the 1950s. He figured out that we're not made the same on the left and the right.
Oh, wow.
So if you just take a regular x-ray and try to get everything lined up, large percentage of people, that's not going to work and it may harm. What you want to do is make sure the joints are lined up and not putting pressure on nerves.
Okay.
So what we do is we can actually see the shape of the joints, and then we can also see if they're lined up, and then we tailor the adjustment to slide the bone back into place right directly where the patient needs it. There's no twisting and there's no popping. We can be very, very precise. You don't need a sledgehammer to put a screw in. You just need a, so first we do that so that I can really see what's going on. And then we give the first adjustment, and then we set up a series of follow-up visits that are checkups, not necessarily treatments. Just because you walk out of my door and then walk back in doesn't mean it got broken, need to be fixed again. So most modern chiropractic is based more on a therapy mindset. Okay, this is tight. We need about 15 manipulations over the course of so many weeks or months in order to loosen it up. And then you need to keep coming and let me loosen it up again once a month for a while. And that helps a lot of people. But if we can figure out why the body is keeping that joint tight and that pain and fix that problem, then the body often will loosen it up itself or only need maybe one or two adjustments and then start moving again like it was designed to.
Okay.
So the checkups are the vast majority of my patient visits during the week are checkups.
Okay.
And I don't have to do an adjustment, and that's what we want. And if I'm not having to do adjustment and the spine is strengthening, then I can see people less and less and less. I end up doing, and I didn't come up with this percentage, a friend of mine who does the same technique did, but I end up adjusting about 90% less than most other chiropractors. 90%. Now, in the beginning, you may still be seeing me just as often, but it should be a short visit just to make sure that it's still going in the right direction. Because in the beginning, your body's used to being crooked. It wants to go back out. If it does, you tend to go backwards and regress really quick.
And by beginning, you mean the first 3 weeks?
Yes.
First 3 weeks. Well, first 3 months, really. But it decreases once a person is stable, the neck is stable for about 3 weeks, we start seeing them less often, and then after another 3 weeks less often. And my goal is, and my predecessor would cringe to hear me say this, but based on 20 years, almost 20 years of practice now, my goal is to get as many patients as I can to the point where I'm checking them twice a year.
Wow.
And not having to do anything.
Yes.
You know, unless they call me up because they had a sports injury or something.
Right.
But basically, the idea is your body shouldn't need a chiropractor. Now, it's good to have one and get checked, just like you want to go to the dentist and get checked, but you shouldn't need to have a filling, right? If you're healthy and you're taking care of your diet and your mouth, you shouldn't get cavities.
Right.
And the same thing with chiropractic. You shouldn't need a chiropractor unless something bad has happened.
Gotcha.
And I want to get people back to that point, or as close as we can.
Yeah. Well, and so how do you incorporate the nutrition? Because the nutrition causes all this inflammation in your body.
Yes.
And how do you coach and talk to people about combining that, getting them right, getting the bones right, with what they're eating? Do you have success there, or is that
Well,
one of the hardest things?
well, I grew up cooking, but it's one of the reasons that we're here at Healthy Meals to Go, because I think that's a really good first step. A lot of people don't know how to do that, and I really love your philosophy of 1% healthier. So if you're really sick and maybe you've had inflammation, maybe you've had a bone out of alignment causing nerve pressure, and you haven't been eating right, it could be overwhelming to start. So one of the things I love about what we do is it doesn't require a big change. You show up to your appointment, the brain does the work, and then you start to feel a little bit better. So now maybe you can think of the next step. It's like I should start thinking about my nutrition, but I don't know how to cook. Well, go to Healthy Meals to Go, buy one healthy meal, see how you like it, ask some questions, and that could be an obvious next step.
Yes.
And then just one step at a time.
And then, that's we have that philosophy. Like, if you can just start that, see some results, then it parlays itself. It just builds on itself,
Right.
and then all of a sudden, you look back after a year, and you're like, wow, look at what has happened.
Yeah. So if you, the nice thing about not having to be adjusted all the time is not like something changes, in your nervous system, in your brain. And that makes it easier to start thinking about the next step.
Yes.
And then you take one simple step, and you think, oh, that food tasted pretty good, and I feel pretty good. Then it's easier to take just the next step the next day, and then it can build on itself. But it's not like you have to keep coming and having this really intensive therapy to get better. You just make it easier.
So one thing with chiropractor, I've been the manipulation for years now, but a lot of people fear that, right?
Yes.
They're like, oh my gosh.
Yes, and I was like that. And some people that have severe symptoms actually can get hurt by that.
Yes.
That was my experience.
So with that, how do they? I want y'all to see and meet them, because we're not hurting. Like, this is the least invasive way to start in chiropractic, to get you
Pretty
right.
much.
And so how do they get in touch with you, and how do you kind of relieve that fear of, oh my gosh, they're going to pop my neck and
Right.
I think the best thing is just give us a call.
Yes.
And we'll have a conversation. So typically the person who answers those calls are me, and I know what it's like to suffer and be in pain. I have 25 years experience of working in the upper cervical office. I have a good understanding of other aspects of health. I know what it's like to be sick and what it's like to be well. And let's have a conversation and steer you towards what are some
Right.
options that you have that we can talk about. If our practice is part of that and it makes sense to work together, we'll talk about that, and if not, it's one of the reasons I'm happy to have these other relationships, such as Veritas and Healthy Meals to Go and such things.
And so with that, what does an initial visit cost? Because that's the other ones that people are scared of.
Everybody asks them.
Yes.
So normally the initial screening is $150. And mention
not expensive at all.
mention Healthy
Yeah.
Meals to Go, and you'll get 50% off.
Oh wow! Thank you. What a blessing. Well, thank you.
So
That is a that is what we're about, is like taking that first step and having the confidence that you're going to get better, right?
Yeah.
And so, all right. Well, thank y'all for taking
Sure.
the time. And
It was a great pleasure.
I'm looking forward to getting in there and seeing you.
Yeah.
And I'm going to bring my mother.
Okay.
So you and we're going to track the results.
Yeah.
And track the positive, and it will be good testimonies.
Awesome.
Right? All right.
Great.
All right. Well, God bless everyone.